Well, thank you so much. Like Justin, I would like to thank the UN for their participation, for their being here, for all that they do across the world, of course. What a tremendous organization. And also thank you, VU. I'm a big fan. I am actually a two-time BYU graduate, so just over the hill and down the road a little bit. But I'm a big fan of UVU as well, and all that's been going on here. This university really has doing tremendous things. So we're grateful to be here. My name is Rebekah Ellsworth. I am here on behalf of Globus Relief. Globus Relief is the largest gift-in-kind charity in the state of Utah. And so I'm here today to tell you a little bit about Globus Relief, what it does, where it comes from, how it does its work. And then, as Justin did as well, and I think most of us, or all of us here today, are going to do, to talk to you about how the mission of Globus Relief and its operations support and sustain those 17 development goals that the UN has set. With something as simple as a plastic glove. Now, this plastic glove, I grew up in a medical home. My dad's a physician. This has turned into a blow-up balloon animal many times in my life, as it maybe has for you. However, these plastic gloves that you see up here on this slide, this is a photo taken in North Korea on a Globus Relief project years ago. If you look at those same gloves, similar to this one I hold today, you'll notice that something is different about those gloves. Namely that, in this case, they have not been disposable. Instead, those gloves have been washed and rewashed and used on hundreds of patients, as long as they last, in North Korea, in hospitals there and in clinics. Similarly, I brought with me our United States healthcare standard example. Single-use syringes. You'll note, it even says, for single use. Note that the writing is actually rubbing off because it has not been for single use in Korea. It's been used over and over again. And unfortunately, also, in that TB clinic, those disposable needle tips, washed and reused, patient after patient, in this clinic. The same with the gauze. Can you imagine the dozens, scores, hundreds of patients that sterile gauze, a one-time sterile, was used and rewashed and reused? And that really, those images I brought today, I think are a really good indication of why Globus Relief exists. Globus Relief was founded in I forgot, I actually got two more. This is a maternity table where women, of course, would have their children. Note that it is covered in floor laminate. And one more. These, which look like beverage bottles, are actually bottles that have been washed. They're being repurposed as IV bags. So they will hang those bottles and drip saline or whatever it is out of bottles covered with tinfoil, attached to tubing that has been used on hundreds of patients. And now the next slide. That brings us to why Globus Relief exists. Globus Relief was founded in 1996 here in the great state of Utah by two businessmen who started to notice the volume of medical product, of disposable, what we would call cheap, medical product that was being discarded by hospitals and clinics as it was trumped by newer, more modern technology, old x-ray machines that were being discarded. And these two men thought, surely there is a better place for these materials than the landfill. And thus was born Globus Relief. They just began to look for other uses for these simple products that we so often throw away, and they began to found them. As you can see, Globus Relief's mission is to improve the delivery of healthcare worldwide by gathering, processing, and distributing surplus medical resources to charities at home and abroad. I want to make sure I got that on the record right. And then that's what they began to do. From that day, 22 years ago, as I mentioned, Globus Relief has become the second largest charity in the state of Utah and the largest gift-of-kind charity in the state of Utah. How does Globus achieve this mission? It's fairly simple. It's a three-step process. Number one, Globus goes in and procures donated, surplus, obsolete, excess, near expiration, etc. inventory from a variety of donors. It could be manufacturers and distributors. It could be hospitals that are going out of business. It could be clinics. It could be even individuals. Some of the most touching donations we have are from individuals who bring the medical supplies, unused medical supplies for loved ones who have passed away. But they don't want those medical supplies to go unused. We bring those into our Salt Lake City warehouse and make sense of them. Sometimes it is literally as if a hospital has emptied its storeroom onto a pallet. And we just open it up and try to make sense of what's inside, focusing on the application and use. Where can this be used? Like those photos in North Korea. And we then put them together in ways that we have found most useful for distributing them out, and through a variety of means, get them into the hands of hundreds, over 1,000 charity partners, 3 of whom, by the way, have representatives in this room today. And by doing that, get them spread all throughout the globe. In that way, Globus is actually a very unique charity, because you'll hear from many today. We just heard from Justin with Women of the World, what great work they do in the field with the people that they serve. Globus is unique in that it recognizes that while all of these charities are out doing these tremendous things, in our case, particularly those related to the medical field, that they need resources to do so. That if Operation Smile goes to the Philippines to do maxillofacial surgery but doesn't have a suture or a scalpel, they're not getting very far. So Globus Relief, in a sense, acts as a charity to the charities. We can provide a one-stop shop so that those charities with medical-related missions can come and acquire what they need in a much more streamlined, easy, and cost-effective way to their charities. And we provide that hub for those medical missions. So it is unique. It is a step up the supply chain, the humanitarian supply chain, bridging the gap between the resources needed and the people and the people who need them. Speaking of impact, as Justin mentioned, that we were asked to mention, I mentioned that Globus has over 1,000 charity partners in its history. 3 in the room today. We've worked with the LDS Church extensively in the past. We've worked with Engage Now Africa, and we've also worked with Choice Humanitarian in this room, in addition to over 1,000 others. Globus in its history has sent over $1 billion of aid to countries across the world. And in fact, that total as of today is 144 of those countries and 13 non-country areas, for example, of the Palestinian territories would fall in that bucket. One of the amazing things, 2 of the amazing things, in addition to what Globus does, is how well it does it. $1 donated to Globus Relief translates to $20 to $30 worth of aid done. You know that in the industry is a leverage factor. $20 to $30 for every dollar that is donated to Globus Relief. And it does it with 99% efficiency, meaning that 99% of dollars are spent on humanitarian programs. 99%. And for that, you'll notice the logo. Globus Relief is awarded as a 4-star charity with Charity Navigator, one of the biggest charity watchdogs or rating agencies in the country. It has been up for 8 years running, and of the 15 years that it has been rated, it has been given 4 stars, their highest rating, 11 of those years. Globus, because of this partnership network, truly has a global reach. I already mentioned 144 countries, 13 non-country areas. I'd like to point out that represents 73% of the countries in the world. It represents 88% of developing countries, and those countries, those 144, represent 90% of the world's population. So truly a global reach by the way that Globus has chosen to do this mission. But of course, as we all know in this business, it's not about the numbers. At least it's not about the numbers alone. It's about the people. So I brought just a couple today with me. This cute little boy from Zambia. His name is Max. He's 4 years old in the photo. He was found by one of our charity partners when he was just a toddler, 1 or 2. He had suffered from malaria as a child. He had neurological effects as a result of that. When he was found, he was severely malnourished in the fetal position, shivering in the corner of a hut. The woman that reached out to him from our partner said he tried to reach back, but his arms were so contracted he couldn't actually extend them. They fed him a supplement and continued to work with him to get him back to being nourished. Globus also works with supplements, vitamins, pharmaceuticals, and the like. And as they returned and continued to work with him, he eventually grew into the 4-year-old boy that you see there. He was given a walker and was so excited to show the worker how he could get around and how he was able to play with his brothers. This is the exact reason we do what we do at Globus. It's for the individuals that it helps, in addition to the big. Now, how does Globus really interact with the United Nations? We have actually worked with the United Nations in the past. As I mentioned, we work not only in these 144 countries and hopefully more, but also in some of the more difficult areas of the world, like the Palestinian territories. And when working in some of those areas, we have worked with different arms and groups of the United Nations to get our supplies into these more difficult areas of the world, such as Syria, Palestinian territories, and so on. Now, we just saw these on Justin's slide, but how does Globus Relief interact with the 17 Sustainable Development Goals set by the United Nations? Well, since everything is so connected in this world, we of course interact with many, but I wanted to highlight 4 where I felt like Globus's mission is particularly pertinent. The first is goal number 1, no poverty. Now, if you go and read about this goal on the UN's website, you'll see that they include that poverty is more than a lack of income. Its manifestations include hunger and malnutrition, which we just saw with Mannix, limited access to education and other basic services, of course, including healthcare. 1 billion people in this world lack access to basic healthcare, and in 2010, almost 100 million people were thrust into poverty, extreme poverty, because of healthcare costs that they couldn't afford. So healthcare definitely has a massive impact on the instance of poverty in the world. As mentioned, as Globus seeks to fill this gap in that humanitarian supply chain to get resources into the hands of providers, whether it's local hospitals and clinics through local governments or in the hands of charity partners, it also lowers healthcare costs across the globe and thus reduces poverty. In addition, Globus has also, over the years, many times helped out with disaster relief. I put some famous examples: Ebola and dengue fever outbreaks, the Pakistan earthquakes, Hurricane Katrina, the big Japan tsunami back in 2011, but even as recent as the recent earthquakes we've had here. Globus will send medical supplies by the pallet off to help with those. Number 3 goal, good health and well-being, is an obvious fit for Globus's mission. It's what we do all day long, every single day. And I just put a few stats, and we're all very aware of the gap that is there, but a 36-year gap in between Malawi, which has the lowest life expectancy in the world, and Japan, which has the highest. And that children from the poorest 20% of households are twice as likely to die before age 5. Now, of course, and 10 times fewer physicians per capita and brain drain in the medical field. This means that those who practice medicine are likely to leave their countries and go where they have resources and the ability to practice. And that leaves, of course, those countries bereft of medical care. So Globus, of course, is trying to raise the standard, as we saw in those North Korea pictures, of healthcare worldwide. We provide better resources, lower cost. In some cases I've read where, in our own stories that we receive from our partners, where successful surgery is dubbed as one where there simply was an infection. Can you imagine if you came out of your operation, your doctor's like, well, I don't know how everything else went, but I don't think you're infected, so you're okay. That was a success. We are looking to eradicate that better products mean cleaner, better care, and a lower exodus of medical expertise out of each country. So this is an obvious one for us. Another one that you don't see as often, but is very much in line with Globus's mission, it may not be as obvious, is responsible consumption and production. This idea of doing more with less, and then being responsible about how we procure, use, and dispose of our resources. Globus estimates that annually it diverts 16 million pounds of medical resources from our United States and wherever we may see from our landfills. 16 million pounds a year we would throw away, and yet we can send them across the globe and make a difference with them. We also strive to be judicious in our consideration of what we send. We don't want to export our landfills to them. So we think very hard about application and use of our product. Because as you see, in the United States, 1% of our non-residential waste is due to healthcare. And in 2012, the U.S. healthcare system wasted $765 billion. Not all of that was medical waste per se, but that is more than the defense budget for that year. It was just the waste from the healthcare system. Globus seeks to reduce that waste and redirect it to much, much better aims. And finally, the 4 that I chose, partnerships for the goals. As we all recognize and as exemplified by our being here today, our partnership with each other, with the UN, and with the governments across the world, as well as with the private sector and individuals, is essential to any of this actually taking place. I believe Globus is a great model for this. I've mentioned several times already this network of over 1,000 charities that is tied together through this hub of Globus Relief where they source their product. Globus also is a great example of working with local governments. We sometimes do projects directly with local governments. And setting up a new hospital in Ghana, we seek to equip the hospital with the local government. We believe that this creates much better and more sustainable outcomes that are aligned with local initiatives and objectives, and raises the likelihood of success of a new project. So I believe that Globus, again, is a great example to refugees in Turkey. Globus Relief truly is the charity to the charities and is bridging the gap in that humanitarian supply chain. Lastly, one other friend of ours with me today, this is Makara. Makara, as an 8-year-old boy, was climbing a tree in Cambodia to harvest fruit for his family and fell. He broke his arm. And all of us would think, an 8-year-old broke his arm, it's fine, it happens all the time. That's what you think when you can take him to a hospital. His arm didn't set correctly, it didn't feel right, and he was losing the use of his arm. Until Children's Surgical Center stepped in, and he was able to go there using supplies from Globus Relief to have his arm set. Again, it seems small, a broken arm. But it's not small when you imagine that 8-year-old boy who has to work in the fields, who has to labor manually to support a family, having to do that one arm for the rest of his life, and what that would mean for him. For him, it's not just a broken arm. For him, it is a way of life. We at Globus are proud to help every person we can achieve a healthier, happier, better way of life. We're so grateful for all of you who are doing the same in each of your own ways.